Our local vet, Dr. Roy, is in studio to answer any of your pet-related questions. So get onto the phone, 083 913 3728. You can ask your questions live. He's also answering questions about pet spaying. And if you've got any questions relating to that, you're welcome to call in. Morning, Dr. Roy. Nice to have you in studio.
Thank you, and nice to be here once again.
I wanted to just ask you about spaying. Why is it important to have your pet spayed?
Well, spaying is sterilization of animals. We sterilize both dogs and cats. And the primary thing is to stop them from breeding so that there's population control. There are, however, also a number of other reasons. Sometimes dogs in later life, if they haven't been sterilized, they can get sick, they can get diseases. And sterilization of males, for instance, prevents prostate cancer in later life or testicular cancer. And in females, unsterilized females are predisposed to mammary tumors, and they can also get a very, very severe disease called a pyometra, an infected womb, which is a life-threatening disease. So if they're sterilized young, then all these problems just disappear. They don't get them.
And can you spay cats and dogs?
Yes, yes. We sterilize cats once again for population control, but an unsterilized male cat, you don't want to go there.
The tomcat.
Oh, boy. Fighting, abscesses, and they spray, they mark territory. Sterilized cats can also mark territory, but the unsterilized male cat comes into your home and marks territory. You just don't want to be there. And then, once again, the female cats, they are what we call demand ovulators. They will only ovulate once they've been served by a male. So they cycle every 7 to 10 days, and when they're in season, they're meowing and yowling, and they want a man and they want it now.
I couldn't think of something quick to reply to that. Talk about the pain management, post-operative pain management that you go through and that the animal goes through. Okay,
it's a very good question. You know, surgical procedures, unfortunately, we cut. And when you cut, when the animal wakes up, there is pain. Many of the anesthetic agents that we use have some sort of post-operative pain care, but I believe very firmly that we have to make sure that the animals are not subject to pain. And there are lots of wonderful products on the market. The vet will inject, I have no doubt, painkillers, but then we often dispense medicines to take home so that pain is managed.
And looking after the pets at home once it's come home from the...
Yeah, also, you know, it's an operation. They've been anesthetized, they've been cut, they're sore, they're confused. And it's, you know, I've had people that you tell them don't, you know, keep your pets quiet, and they take their dog for a walk after sterilization. So the bottom line is treat your animal as you would yourself.
Yes.
You give yourself some time to recover. Give your dogs and cats 24, 48, 72 hours to recover from the surgery. Absolutely.
Now, Dr. Roy, we've got Edna on the line from Durban. Edna, morning. You're live on eXpresso. What's your question for Dr. Roy?
Hi, Dr. Roy.
Morning, Edna.
Morning. I just want to know about my dog is a Chow Chow. She's been spayed. She's got a bladder problem. And I'm treating her with Renex and treated her with inocurin.
Inocurin, yes.
And she's still got the problem. She just can't hold herself. She just wheezes all over.
Yes, this is unfortunately a lot of sterilized animals, sterilized female dogs specifically, can become incontinent in later life. One has to check and make sure that there are no underlying causes. And if there aren't underlying causes and it is called what we call a hormone-associated incontinence, then certainly your vet will have a number of products and a number of different techniques. So if one doesn't work, you have to try another one.
Well, I think that's what my vet is doing. You see, he's trying things, because there is something that is in the market from overseas, which is coming into our country, so he's waiting for that.
Yes, so that's a good thing, certainly.
There's no operation or anything that can be done to tighten the muscle or anything?
Yeah, there are, but I think that medication is probably the easier and probably even the cheaper route.
Edna, I hope Dr. Roy managed to answer your question. Thank you so much, Edna.
Thank you very much.
Thanks, Edna.
Dr. Roy, thank you so much for joining us. If you've got any other pet-related questions, feel free to post them on our Facebook page, eXpresso Morning Show SABC3. Now, Katlego standing by with our 3 guests, Mark, David Kramer and Christy Davids, all in our studio here today.
Stay with eXpresso and SABC3.